Ozempic is now a common name. The diabetes drug making headlines as celebrities and social media influencers share how it helped them quickly lose weight. But that doesn't mean it's a miracle treatment. Joining me now is Dr. Mehrshid Kiazand, an obesity specialist at UPMC, for our Health Talk segment. Thank you so much for being here.
Thanks for having me.
So it's not just Ozempic. There are other drugs out there similar. But are these medications really a weight loss solution?
They are great medications. I want to start the talk with, thinking about obesity as a disease.
Right.
It's a chronic disease. It's really common. About 40% of U.S. population have obesity, which defines as a BMI of greater than 30. BMI stands for body mass index, and it's a weight divided by height. So it's a common disease, and what these medications are doing are doing something that the previous medications were not doing, meaning they're working very well. The amount of weight loss that people experience are significantly higher than previous medications. The side effects are less. People generally tolerate it well. The interaction with other medications that people are taking chronically are very minimal, and also providers are very comfortable to prescribing them. So is it a game changer? For sure, but that's what we have for now.
Yeah.
What would come in a few years might be even better than this.
Right. So what is in the drugs, not just Ozempic, but there's another one that you had mentioned.
Wegovy, yes.
Okay, so what is in it that is actually working to help you lose weight?
So what they do is working like one of the enzymes that are very much responsible for helping people to keep the weight down or even losing weight. It does send signals to brain and stomach to make us not feeling hungry and also help us to keep the weight down. There are two main things that these medications are doing, and again, the way that the brain is set up is trying to push the weight back after we lose 10 pounds, 15 pounds, and that's what I hear from my patients coming and saying, the first few months were great, I lost 20 pounds, but then I started gaining it back.
So that is happening with some people.
That is happening,
yeah,
for sure. And with these medications, as long as they're taking the medications, the weight loss would stay the same.
So we hear a lot about Ozempic now being tied to weight loss, but how is it working as far as a diabetes drug?
So it actually started with, thinking about a medication that can help with sugar control or glucose control.
Right.
So in like 2013 or 2014, they started to studying this family of medications because they knew how the hormone works with pushing the insulin to actually get released from pancreas. When they did that, they found the side effects to be weight loss. So that's how the focus actually happened to be on these medications solely for controlling weight.
So as an obesity specialist, I don't know if you have people coming in saying, Doc, can you give me some Ozempic? I need to lose weight. I need something that's going to help. Are you prescribing this, or are you finding that patients can ask their doctors for something like this?
So Ozempic is FDA labeled, it's labeled by FDA for diabetes management. For weight loss, we FDA labeled Wegovy for patients who do not have diabetes and just want to lose weight. If patient has a BMI of greater than 30 or BMI of greater than 27 with the complications of obesity, which could be diabetes, could be arthritis, could be sleep apnea, they do have an indication to be on anti-obesity medications, including Wegovy.
Wow. So it's something that you can talk to your doctor about.
Yes, for sure.
We are hearing about these like Ozempic celebrity parties, but they're paying a lot of money out of pocket to be able to get them for this reason. What are you seeing? Do you find this to be a dangerous trend?
So, again, we are working and looking at guidelines and evidence.
Right.
And the evidence is very clearly talking about a certain BMI and the complications of obesity. People who have 10 pounds extra and want to lose weight for certain activities, for example, a gathering or some sort of social gathering, and they use these medications, they will lose the 10 pounds, but then they're going to gain it back as long as they stop it. So we do not recommend first of all, using off-label medications, for example, Ozempic, just for weight loss on patients who are non-diabetics. And the second thing, it's not recommended to just use it randomly for just a little bit of 5 pounds loss here and there.
Right. I want to talk to you about something else that's starting to come out, and there may not be a lot of research behind it, but there were some patients who were pointing to this as possibly helping with addiction as well. Can you talk about that?
Yeah, thank you for bringing it up, because there is a lot of talk about it. And so what we know is that anti-obesity medications in general help with some behavioral modifications. For example, people feel less anxious, less depressed. But there is really no evidence on labeling Ozempic or Wegovy as anti-addiction medications yet. There are studies going on, but as of now, there's really no human studies proving that. Having said that, some of our patients coming to us and saying, I really don't need to smoke as much as I was doing before, or I don't need to drink as much alcohol as I was drinking before. So these are all the reports that patients share with us, which actually we are very happy to hear.
Yeah, patient stories, and maybe it'll lead to something more in the future.
That's for sure.
Thank you so much. I have so many questions. I feel like we could talk about this topic forever, and about obesity. It affects so many people, and weight loss too. So thank you for sharing some of your time today.
Thank you so much for having me.
We really appreciate it.
Thank you.